Thank you, ma'am. Thank you. So, ma'am, 476 cases, one death. I'm not sure if I have the correct numbers now, but what measures are currently in place to combat the spread of the coronavirus there?
So New Zealand is currently in level 4 of the COVID-19 alert system, and the Prime Minister has indicated that this will last for 4 weeks at least. And this is part of New Zealand's combined effort to break the chain and to stop the spread of COVID-19.
So, do you feel that you have adequate supplies of protective equipment and medical supplies over there?
So they're in hot demand. We have a lot of frontline workers in need, but just in the last few days, we've had an additional 7 million sets of face equipment brought out because we're requiring more. So yes, we have a local manufacturer who's able to supply, and we're working incredibly hard to make sure everybody in those frontline positions is able to feel safe.
So we hear that testing is key in controlling the spread of the virus. How available is COVID-19 testing now or in the very near future?
This is just a story tonight on the news in New Zealand that we are currently increasing the availability. So it has been widely available, and we want to make it more available because we know, as you've already mentioned, that it's critical in identifying and stopping the spread.
So does New Zealand also have a national stockpile or repository of antibiotics, vaccines, chemical antidotes, antitoxins, other critical medical supplies similar to the U.S.?
We have a good supply. Yes, we're in good supply.
Okay, so I understand also that there is a primary phase of tackling the coronavirus, and that is through primary care and other pandemic infection prevention control measures. The transfer and infection must be controlled, but there is also a parallel complication in dealing with the even bigger economic crisis to follow. How is the New Zealand government planning for the next phase of this problem?
New Zealand has gone early and gone hard with a very significant economic package, and the forefront of that has been in the form of a wage subsidy. So all employers are able to apply for 12 weeks of subsidy, and that is able to be making up to 80% with their top-up of wages. That's available for both full-time and part-time employees, and a vast majority of those applications have already, the funds have come through immediately. From my local area, I've had a number of cases where employers have received the funds the next day, so that employees can receive that funding. In addition to this, we've also increased all main benefits by $25 per week, and also we have what we call in New Zealand the winter energy payment, which is a subsidy specific for those who are over 65, and that's for heating for staying inside. So there's a doubling of that additional funding to enable the elderly to stay warm and stay healthy during those colder months.
So, ma'am, in the U.S., there has been some initial misunderstandings, which may have lost significant time and ground in tackling the spread of the virus. So how is New Zealand prepared to tackle new and arising complications due to agreeing on the most effective and quickest manner of dealing with this crisis?
Well, the unresounding message, the strong message from our Prime Minister and from all of the leaders across different sectors on this response has been to stay home. And if you stay home, you save lives. And so we have new powers for our police to make sure that those people who are not remaining home are brought to the attention of police. And so while this is a difficult time, that particularly if you're like me and have young children, keeping them occupied is not easy while having to work from home. But if we stay home and if we abide by these rules, it will save lives.
We have been seeing worldwide an enormous anxiety on the side of the frontliners, the medical staff. How are you dealing with this problem in the short and long term, ma'am?
Look, it's important that they're equipped and they have everything that they need, and that's important that we continue to get supplies out to the frontline workers so that they are having the right safety equipment. In terms of how things develop, that is also very much dependent on the community making sure they stay home, because we can really, as we've said, we want to see that curve flattened out. If we can see the curve of the virus flattened out, that means that our hospital services are able to cope with the number of people requiring higher level treatment. If we see a spike or a sharp increase in numbers, that would put additional strain on those hospital services and frontline workers. So by having very strong messages out to the general public about remaining home and saving lives, we hopefully will manage to flatten that curve.
Earlier you talked about how you're going to help your citizens and the residents. So how is the aid going to be sent to people? Is this going to be through checks, through their personal accounts? Can you expound on that?
So the subsidy that I've already spoken about is applied for online by the employer, and all employers in New Zealand are eligible to receive that, all businesses. So they're required to fill out a form online regarding their employee, the amount of hours they usually work, and that money comes to the employer, and it is then provided to people as in the form of wages.
All right. So on some level, you want people to be conscious of it, and this may drive better precaution. But this awareness that we were talking about can also be quite anxiety-inducing, and this can be also quite taxing for the frontliners that you were talking earlier. What can you suggest?
Look! Those in the front line have that, like a really strong message of support from all New Zealanders. It's been really heartening to see how many good messages and how many good, strong, kind words are sending out to make sure that those people who are going out daily are making New Zealand a safer place for all of us. A big particular thank you to those people in jobs like supermarkets who are having to provide enabling food to be available for the population. For those who are providing nursing, midwives, doctors, all of those services, they are our essential workers, and we have been very strong to say that we quite simply just wouldn't manage to keep doing this and saving lives without their help every day.
All right, thank you, ma'am. I know you're a very busy woman. Thank you so much for your time. Take care. Look out for each other's health. Thank you so much for your time, ma'am.
Thank you very much.
All right. Ms. Ginny Anderson, a member of the New Zealand Parliament from Hutt South Electorate.